Welcome to the Advanced Resuscitation course, presented by the Department of Emergency Medicine at ICRA International Hospital and Research Center in Kozhikode.
Before we delve into the specifics of advanced resuscitation, let's take a moment to introduce the core principles that guide our approach to cardiac emergencies. We'll begin with the critical importance of the chain of survival. The chain of survival outlines the critical steps for managing cardiac arrest. It starts with recognizing the arrest and calling for help, followed by immediate CPR with chest compressions. Early defibrillation is key, along with advanced cardiac life support, post-resuscitation care, and ultimately, patient recovery. Each link in the chain of survival is vital, and timely intervention at each stage can significantly improve patient outcomes. Now, let's shift our focus to the different cardiac arrest rhythms we may encounter during resuscitation efforts. Understanding the underlying rhythm is crucial for guiding our treatment decisions. We'll now explore the importance of early defibrillation in managing specific cardiac arrest rhythms and improving survival rates. Defibrillation is a life-saving intervention for certain cardiac arrest rhythms, but it must be performed correctly and promptly. We'll now cover the proper techniques and considerations for effective defibrillation. Let's begin our examination of cardiac arrest rhythms. Understanding these rhythms is critical for determining the appropriate course of treatment during a cardiac emergency. Why is early defibrillation so crucial? Because for certain rhythms, it's the only way to restore a perfusing rhythm and prevent irreversible damage. Rapid defibrillation is key to improving survival. Defibrillation delivers an electrical shock to depolarize the heart muscle, allowing the sinoatrial node to regain control and restore a normal heart rhythm. Knowing when and how to defibrillate is essential. In cases of asystole, you must first confirm that the flat line on the monitor is a true representation of the patient's rhythm and not due to lead displacement or equipment malfunction.
Pharmacotherapy plays a vital role in advanced cardiac life support. Epinephrine is administered at 1 milligram IV.
While medications can be helpful, it's equally important to identify and address any reversible causes contributing to the cardiac arrest. Let's now examine some of the most common reversible causes. Remember the H's: hypovolemia, or low blood volume, hypoxia, or inadequate oxygen, hydrogen ion excess, leading to acidosis, hypokalemia or hyperkalemia, imbalances in potassium levels, and hypothermia, or low body temperature. Identify and correct these issues promptly. And the T's: tension pneumothorax, tamponade, cardiac, toxins, thrombosis, both pulmonary and cardiac. These are critical to remember. Addressing these quickly can significantly improve patient outcomes. Let's revisit the chain of survival, emphasizing its importance in improving outcomes. Remember, it starts with recognizing the arrest and calling for help, followed by immediate CPR, early defibrillation, advanced cardiac life support, post-resuscitation care, and ultimately, patient recovery. Now that we've reinforced the importance of the chain of survival, let's shift our attention to the critical steps involved in post-resuscitation care. The goal is to optimize hemodynamics and ventilation. Effective post-resuscitation care requires a multifaceted approach. We will now delve into the key elements of hemodynamic and ventilatory optimization, immediate coronary reperfusion, targeted temperature management, and neurologic care. The key to successful post-cardiac arrest care lies in these 4 areas: hemodynamic and ventilatory optimization, immediate coronary reperfusion with PCI, targeted temperature management, and comprehensive neurologic care and prognostication. Of these key components, targeted temperature management deserves a closer look. Let's explore how and why we use temperature management after cardiac arrest to protect the brain. Targeted temperature management, or TTM, is administered to comatose patients after cardiac arrest to protect the brain. The goal is to maintain a temperature between 32 and 36 degrees Celsius for at least 24 hours. Prognostication, or predicting the patient's neurological outcome, should be delayed until at least 72 hours post-cardiac arrest. For patients who underwent targeted temperature management, delay prognostication for at least 72 hours after they return to normothermia. Unfortunately, despite our best efforts, resuscitation is not always successful. We must understand the factors that guide the decision to terminate resuscitative efforts. We'll cover those now. The decision to terminate resuscitative efforts rests with the treating physician, considering factors like the time from collapse to CPR and defibrillation, any comorbid diseases, the patient's pre-arrest state, the initial arrest rhythm, the response to resuscitative measures, and whether ETCO2 is less than 10 after 20 minutes of high-quality CPR.
Effective resuscitation requires strong team dynamics. This includes clear roles and responsibilities, knowing your own limitations.
Communication is the backbone of effective team dynamics. We'll now explore the key elements of effective communication during a resuscitation event, including knowledge sharing, summarizing, and reevaluating the situation.
During a resuscitation, it's critical to share knowledge, summarize the current situation, and reevaluate the plan as needed. Clear and concise communication ensures everyone is on the same page and working towards the same goals.
Effective communication relies on closed-loop communication, where the receiver confirms understanding of the message. Deliver clear messages and treat all team members with mutual respect. This promotes a collaborative and efficient resuscitation effort.
Thank you for participating in this advanced resuscitation course. We hope the information presented will enhance your ability to respond effectively.